My name is Tadeja Ravnik. I'm a board member of PHA Europe.
I'm Nina Kobler from Slovenia. I've been living with idiopathic pulmonary hypertension for 10 years, and I am a board member of PHA Europe.
My name is Nidhy Varghese. I'm a pediatric pulmonologist at Texas Children's Hospital in Houston, Texas.
My name is Lucilla Piccari. I'm a pulmonologist specializing in pulmonary hypertension, and I work at Hospital del Mar in Barcelona.
I'm Anna Rodó. I'm physiotherapist here in Hospital del Mar in Barcelona.
My name is Patricia George, and I'm a PH pulmonologist from Denver, Colorado at National Jewish Health and co-founder of Team Phenomenal Hope. So I'm now going to turn here to my left and talk with Lucilla. You are very involved, of course, in pulmonary hypertension related to lung disease. And there also is a little bit of a diagnosis issue there as well. Can you speak to that?
Yeah. Pulmonary hypertension in the context of lung disease is not a rare disease. It's actually relatively frequent, and there are some lung diseases that by themselves are rare diseases, such as idiopathic pulmonary fibrosis or other types of pulmonary fibrosis that are not so common in the adult. And in that context, pulmonary hypertension is relatively frequent, especially as the disease progresses. But there are very prevalent diseases such as COPD, which are affecting 7 or 9% of the general population, adult population. And in that context, pulmonary hypertension is quite frequent. So imagine a common prevalent disease where there's frequently a vascular complication. That obviously means that in the world there are potentially many patients with pulmonary hypertension associated to COPD. And the problem of the diagnosis there is that these patients already have a lung disease. So they see a specialist who will say, yeah, of course you're short of breath because you have a lung disease. But there is a certain aspect of extreme difficulty to perform any sort of exercise, which is really when we start to suspect that the vascular component of the lungs is also involved. So this means that not being able to walk to the corner of the street, or not being able to make your bed in the morning, or sometimes even having trouble showering. These are all signs that apart from the lung disease itself, which may be giving you shortness of breath, there is also the pulmonary vessels that might be involved. But there is a big barrier to, I guess, making people think about PH. And the other problem is also that when I was studying pulmonology, I was told that certain patients with COPD, advanced COPD, develop pulmonary hypertension, and that is the normal course of their disease. So there is a sort of normalization that this is what is going to happen, and it's sort of like, oh yeah, this is normal and there's nothing we can do about it. But instead, we are starting to have finally some treatments available in pulmonary fibrosis with pulmonary hypertension. There is now a drug available in the US, and there are other clinical trials. So finally, we're starting to be able to do something about it, which means that we can actually look for it, and we should raise awareness of this problem.
And I know there also are clinical trials in PH-COPD that we'll be hopefully hearing about in the next few years. We'll see. I don't know the timeline on that, but there certainly is some hope on the horizon.
There's a couple of trials that are currently ongoing with a good basis, a biological basis for the drug. So we very much hope that finally we can give something to these patients in terms of treatment.
One of the things we can give to patients now who have lung disease and pulmonary hypertension is something that we call pulmonary rehabilitation, or physical therapy for the lungs. And so, Anna, I wonder if you could speak a little bit about how you treat patients.
Yeah. So I'm a physiotherapist here in Hospital del Mar. And as you said, we, of course, know that the first treatment and the first thing we got to do with the patients is give medication when they need. But it's very, very important to remember that there's also more things to do, like, of course, exercise and rehabilitation. As I was listening to your story and you explained, I can't do things, though I feel I'm not like crazy. and you're young, no, you're supposed to do things. Once the medication or transplant or whatever has arrived, we can keep going and helping you. So our work here with this patient is to give them advices and tips that you can use out of a medical center. Of course, main thing is that always supervised or with medical team give you all the recommendations that you have to follow. You cannot go to the gym and do whatever you want. You just have to keep, how you say that, your effort, your exercise in a range of security. You have to use, for example, oxygen if it's necessary, just for being in a rest situation. Imagine, no, when you move, you need also to use it. You don't have to compare to other ones. You are yourself, your disease is your disease, and you feel like you feel. You don't have to do what the other one is doing, so you have to do your path and improve comparing to yourself, not to the other ones. And it's very important to share and to look for something that you are really motivated to do. If we plan a rehabilitation program which is boring and it's always the same exercise, they're not coming. We know that. They say like whatever, no. So we can ask, we have to know our patients and give them the opportunity to bring these advices to their life to continue moving and improving their exercise capacity, because it's beneficial for everyone, for health people and for patients also. So important for them to know that we are with them and they can ask whatever they need, whenever they want, to don't stop moving, no, and understand that it's a part of a treatment also, like the medication. Yeah.
Yes, Anna, as you said, we would really like to compare because we would like to share our feelings. That's why the associations meetings, patient meetings are okay. But as you said, your body, your disease, and you have to improve step by step. And I think that this is really important for patient to understand that you have to slowly improve and you will get there.